friends. I'm Dr. Naresh Srivastava, Orthopedic Consultant and Rehab Consultant at Madhani Polyclinic, Campus, New Delhi. Today we are going to discuss osteoarthritis or arthritis of the knee. Arthritis is affliction of the joint where the cartilage is stripped off and there is pain in the knee as well as restriction of movement. For us to understand arthritis, we have to know the architecture of the knee joint. The knee joint, as we call it, architecture or anatomy. The knee, as we know, is it has two main bones. The one bone is of the thigh bone, which is known as femur. This is femur. And the other one is tibia, which is the leg bone. Now, the knee joint comprises of these two bones standing on each other. Now, the bone is like a wood, so it's rough. And to make the movement of knee, to facilitate the movement, there are certain structures in the knee joint which help in the smooth movement of the knee joint, of the bones on each other. Now, the whole weight of the body is limited to this area. You just see, this is the area, this is the thigh, this is the leg. So, the knee joint has to be very versatile to take the load and to move. To facilitate, now these two are like two wooden pieces standing on each other. Now, to help the movement and to smoothen the movement, the end of the bone is covered with a cartilage. Cartilage is not like a bone. It's like it's a soft structure, very smooth. To make the movement smooth, both the bones, tibia and femur, they are covered in the lower end by the cartilage. Cartilage, as you can see here in the model, this is a rough model. This colored part is the cartilage, and this part is the bone. This is cartilage, this is bone. Now there's another cartilage over tibia. This has a cuff around it, and so the movement of the joint is smooth, as you can see. Now, to help further the movement, there is fluid in the joint, which is known as synovial fluid. Synovial fluid comes from a sac-like structure which covers from here to here, and the fluid is secreted from it. So it's like a film, a small film, and which helps the movement of the joint. Now, in arthritis, this part, the cartilage of femur as well as tibia, they get stripped off. And when they get stripped off, the raw bone is in contact with each other. That causes pain and restriction of the movement. This is basic this is the basic thing in arthritis of the knee. Now, the causes can be multiple. It can be injury, it can be infection, and there are certain age-related conditions also, which is normal wear and tear. There's another thing which is known as rheumatoid arthritis, which is an autoimmune condition, where the cartilage automatically, because of the loss of autoimmunity, the cartilage is stripped off. Now, all these things lead to pain and restriction of the movement. Now, as far as injury is concerned, any fracture around this area will disturb the architecture of the knee joint. There might be changes in the angle, there might be muscles which will restrict the movement, and ultimately leading to cartilage destruction. Infection is like tuberculosis or after injury and infection, which will again, this cartilage will get stripped off. These are the basic normal things which can happen. And in age-related things like as we grow old, the cartilage, the secretion is reduced. The cartilage is normal wear and tear can cause this thing. Then there are certain things like injuries and overusage or underusage. The things which are commonly which cause arthritis of the knee or they are predisposing factors are like diabetes, overweight, sedentary lifestyle, and overusage, like in cases of very high intensity sports. These all can cause arthritic changes in the knee. And treat and the presenting symptoms are a little bit of swelling can be because of the synovium, the fluid, increased fluid, and restriction of movement, which means the full range of movement will not be there. Then there might be deformities, like it can be there can be an angular changes in the joint, and when it can lead to bow knees, which is like this bone going like this, and so these are the main sequelae of the arthritis. The treatment is basically weight control. Weight has a very predominant role in arthritis knee because this small part is basically taking up the load of a 40, 50, 60 or 80, 100 kilograms, whatever you are. The diabetes can cause a little bit of thickening of the synovial fluid, and then there are sedentary lifestyle, which means the lack of exercises and all those things. These can lead to arthritic changes, and some people are lucky, some people are not so lucky. Some people may not get arthritis, some people may get arthritis. There is not certain. Besides these things, there are not exactly everything is same for everybody. So the treatment is like you have to take medication, you have to exercise, get your weight down, keep your blood sugar level within limits, and then there are exercises, therapies, and medication. With all these things, I think arthritis can be managed, but there's no permanent cure for it. Once the cartilage is stripped off, there's no way the cartilage can regenerate. So if you take care of your weight, take care of your diabetes, do moderate exercises, keep your knee mobile, and naturally take advice if you have any problem. I think this will give you some idea of arthritis, and that's all. The best.